Welcome to India TV. You're watching Health DNA. I'm Anshu J. Singh, and today we are going to talk about diabetes, which is rightly called a silent killer. Today on World Diabetes Day, we have Dr. S K Wangnoo, Senior Endocrinologist from Apollo Hospital, and he's going to talk about diabetes and how to overpower it. Welcome, sir.
Thank you.
So, what is diabetes and why is it called a silent killer?
Yeah, in simple term, diabetes is a disorder where body is not able to produce enough insulin or it is not able to produce insulin at all. So that because of the lack of adequate insulin action, the body is not able to metabolize glucose, so glucose rises in the blood. So high blood glucose level is called diabetes. Why it is called silent killer? Because unfortunately the type 2 diabetes, which basically occurs, mainly it can occur at any age because younger generations are also getting affected with it. Though it occurs, initially it used to occur above 40 years. 90% of the patients are asymptomatic. Asymptomatic means they don't have any symptom and suddenly they go for the health checkup and they get a blood sugar checkup and they see the sugars are around 300 and 400. That is number one. The diagnosis is late. That is why it may cause damage slowly and slowly because the diagnosis is late. Number two, the diabetes, the high sugar which affect each and every organ of the body, right from head to toe, the eyes, the liver, the heart, the kidney, the nerves, any system, genitourinary system. The symptoms of those complications appear very late.
So, what are the tests for diabetes if we have to just,
Yeah, for the diagnosis of diabetes, we tell the patient to do a fasting blood sugar and 2 hours after a 75 gram of anhydrous glucose load. If a fasting sugar is more than 126 and 2 hours after the glucose is more than 200, you are a frank diabetic. But if your fasting is between 100 to 125 and your 2 hours post glucose is between 140 to 200, you are called a pre-diabetic, a stage before the diabetes. And the diagnostic test is doing fasting sugar alone or with the after the taking glucose. And second important test to diagnose diabetes is a term what we call HbA1c. It is called glycosylated hemoglobin. Everybody knows about this for nowadays because so much of education awareness. If HbA1c is more than 6.5, you are a diabetic. If it is between 5.7 to 6.5, you are in the range of pre-diabetes.
You just mentioned how common it has become. So, is it hereditary?
India is the second to the as far as the number of diabetics are concerned in the world. The first is China, and we are roughly around more than 80 million of patients suffering from diabetes. Half of them are pre-diabetic. They are not yet developed full-blown diabetes, and half of them remain undiagnosed. That is number one. And why it is becoming more and more in country like India? Purely because if we see over the generation, initially there were lack of food, people used to, hunter-gatherers, we used to tell them, they had to thrive on the jungles and fruits and everything. So the God had given them some genes, we used to conserve calories, so they can remain fasting for days together. Over the years, the generation and generation, there has been economic development, industrialization, and that has led to the rapid availability of the food to everyone now. With that, what happens? We are having the same genes, what we call the thrifty gene. And when we start eating high caloric dense food, the junk foods, and the lot of carbs and fat, we try to conserve energy because of those genes. And we start getting overweight and obese. And obesity is associated with insulin resistant state. So with the parallel rise of the obesity prevalence, we are having the parallel rise of the diabetes because of the insulin resistant.
Correct.
And the bad fat is around the belly.
Absolutely.
We call the bad fat around the belly. The central adiposity fat, which contain all the inflammatory markers which are responsible for the causing the damage to the vascular endothelium.
So what are the risk factors?
Yes. The commonest risk factor for the diabetes, first of all, is your body weight. If your body mass index is more than 25 or 23, between 23 and 25 is called overweight, more than 25 is called obese. Number 2, if your waist circumference is more than 90 in case of males and more than 80 centimeter in case of females. If you have certain signs of insulin resistance like darkening of the skin around the nape of the neck,
Ji.
if you have got double chin, if you got some skin tags, so these are some of the warning features that are going to develop diabetes. Third, if you are not doing regular physical activity, you lead a sedentary lifestyle, and you consume lot of carbs and high caloric dense items like pizza, burgers, cold drinks, chocolates, ice cream. And lastly, but not the least, if you have got a family history of diabetes, you are at a risk of developing diabetes. Suppose one of your parents is diabetic, you are at a risk of 25% of developing diabetes. If both the parents are diabetic, you are at a risk of 50% risk of developing diabetes. If none of the parents are diabetic, still you have a risk of 5 to 10% of developing diabetes.
So if I talk about symptoms.
Like I told you initially, the majority of the patients have no symptoms. But with the patients, the classical symptoms of the diabetes, the commonest symptom is that patient goes to the loo quite often, he feels thirsty, he gets frequent skin infection, and the wound, if he get a small wound, it doesn't heal properly, and sometimes the patient has a weight loss despite having a good appetite because of the high blood sugar. But losing weight unnecessarily, having a normal diet because of all the calories are being thrown out of the urine in the form of the glucose. So watch out these symptoms, and I tell the patient, if you have family history of diabetes, you feel unexplained weakness, lethargy, asthenia, check your blood sugar.
So talking about the types of diabetes, what is and how to differentiate between type 2 and type 1 and who it affects?
See, there are three major classifications of diabetes. One is the type 1, other is type 2, third is the gestational diabetes, GDM.
Okay.
Type 1 is basically a purely autoimmune disease which can occur from birth to any age. Initially, we had the idea that type 1 diabetes occurs in small children. No.
Yes.
It can occur from birth to the old age. But usually we see the patient at the younger age, say around 3 years, 4 years, 6 years, 8 years. We have the youngest child of 1.5-year-old who had developed type 1 diabetes. While type 2 diabetes is entirely different, it is a sort of a heredity where the parents are diabetic, and it is primarily because the pancreas is not able to produce enough insulin, and whatever insulin is being produced, it is not acting properly. So it is called of insulin resistance. While in the type 1 diabetes, there is total lack of insulin production from the pancreas. So there is no other treatment available except giving insulin from outside. The pancreas doesn't produce insulin. Type 2 diabetic patient produce insulin, smaller quantities, and that too is not acting properly at the cell level. And gestational diabetes is one which purely and entirely occurs during the pregnancy. It is most common between 24 to 26 weeks of pregnancy, where the maximally we see the females having abnormal glucose tolerance and they develop gestational diabetes.
So do you think diabetes is reversible?
Is a big question. Ideally, no. Once you have developed diabetes, it is not reversible. You can use the term remission. You can achieve remission in diabetes once you have developed diabetes, and that can be done by purely having lifestyle modification, losing weight, bringing to the ideal body weight, and continuing for a regular time. And if you are able to lose at least even 10 to 15% of your baseline weight, you can achieve a remission of diabetes for a year or two or something. So that is called remission of diabetes. In some patients, what we have seen, where they are having only pre-diabetes, and unfortunately people say, oh, you have developed diabetes, though he is in a pre-diabetic state.
Correct.
Those can be what you call prevent diabetes for the near future, or in that case you can say that he has become reversal of diabetes, that is the pre-diabetic state to the normal state. But once you have developed full-blown diabetes, you can have good remission, but you cannot cure the diabetes. Till now there is no cure for diabetes.
So how to manage then?
Simply mantra for the diabetes management is maintain your body weight, number one, with the help of the proper diet and exercise. I tell to my viewers that diet should be a balanced amount of carbs, protein and fat. There should not be too much of carbs in a diet. 55% should be from the carbs, 20% from the protein, 20% from the fat. And the fat, if you are taking, it should be totally avoid of the saturated fat, dalda, ghee, all those, they should avoid of the saturated fat. Second, exercise regularly. We tell all our diabetic patients that exercise 60 minutes per day, all days in a week. Because most of the organizations tell, okay, 50 minutes, 5 days in a week, but Indian patient, they require 60-minute exercise every day, daily. And third, avoid the high density caloric item. What do you mean by high density? High density means a laddu contains lot of calories, rasmalai contains lot of calories, and your cold drinks contain lot of calories, and alcoholic drink contain lot of calories. Pizza is full of cheese and everything and fat. Avoid those items. Correct. So we tell them A, B, C, D, E, and there's another F. There's a what you call a parameter by which we check whether the patient diabetes under control or not. It's called HbA1c.
Yes.
So A means keep your HbA1c less than 7%. B means your blood pressure should be less than 140 by 90. C means your bad cholesterol, which is basically causing many of the patients to have a premature heart attacks. The bad cholesterol is called LDL.
Yes.
It should be less than 90. And if you have got hypertension, family history of diabetes, family history of heart disease, it should be as low as 50 also. D is the diet and exercise. E is that you should check your eyes, and F means feet. Because the main cause of blindness in the world is the diabetes. And main cause of the amputation, lower limb amputations, non-traumatic, is because of diabetes. If you remember A, B, C, D, E, F, this mantra will keep your diabetes at bay and you can prevent the complication.
So you just mentioned about myths. What are the common myths that people come to you
I
with?
think this is a very, very important point of discussion. First of all, people say that diabetes is the end of the life, number one. I tell my patient, if you control your diabetes nicely, you will lead as long your life as compared to non-diabetic. So your life will not be short. You will have your own lifespan. Number two, people say, when I become diabetic, I can't eat anything.
Yes.
Oh, there's nothing to eat for me. I tell them, eat everything except the direct sugar. You can have any kind of a fruit, including mango, banana, grapes, everything, but in quantity advised by the doctor. And also, rice, people say is not you can take rice, you can take potatoes. This is myth. By taking rice, our sugar will go up. So, diabetes is free to eat everything except the direct sugar. Direct sugar, I told you, it's sugar, sweet, jaggery, ice cream, cold drink, chocolates. Eat rest everything.
Okay.
So that, and exercise properly. The second myth which is very prevalent among diabetic patients is that, oh, I am going to get all sorts of complications. I am going to die of heart attack. I am going to die of the kidney failure. We tell the patient, keep your HbA1c less than 7, keep your blood pressure normal, keep your bad cholesterol normal. You won't develop any complication down the line at least for 25 years. So this is very important. And lastly, the girls tell me, I have developed diabetes, I can't marry, I can't produce children. Absolutely a myth. The fact is that even the girls who have developed diabetes and they get married, they get pregnant, they can have normal babies without any problem. Only thing they have to maintain a good sugar control during the whole pregnancy. And
How common is diabetes in women these days? And especially during pregnancy, as you said, ki women develop diabetes during pregnancy.
see, I will tell you, the diabetes during pregnancies is remarkably has gone up. The reason being the incidence of polycystic ovarian syndrome, which is a condition where the female start getting irregular period, they start getting some abnormal facial hairs, they start getting some acne on the skin eruptions and irregular period. They are termed as polycystic ovarian syndrome. And this polycystic ovarian syndrome is primarily because of the insulin resistance, because that produces excess of male hormone from the ovaries which cause these manifestations. And also the insulin resistance causes weight gain. And when these females get pregnant, they normally start developing gestational diabetes during 24 to 26 weeks. As the PCOS is increasing, our incidence of gestational diabetes is also increasing. Can you imagine that what we have seen, every fifth girl in Delhi is having PCOS, and imagine how many females will develop gestational diabetes in near future when they get married and when they become pregnant.
So how common diabetes have become in youngsters? You know, why are they getting so prone of diabetes?
Initially the diabetes, type 2 diabetes, we used to see about the age of 30 years. Now, over the last few decades, we are seeing diabetes even in children as young as 14 years, even 12 plus. Why this is so? Why the patient type 2 diabetes are younger children? We call them young onset type 2 diabetes, young diabetes. And this is primarily because our lifestyle, our younger generation, the children, overburdened with the schoolwork, carrying very heavy bags, sitting in front of the computer and the TV. The screen time is always more than 6 hours for every children. So they become obese, they become overweight, they develop insulin resistance, and that is why they are getting diabetes at a younger age.
Talking about the long-term consequences of diabetes, what are the long-term complications?
Yes, the long-term complication basically we divide into which involve the small vessels of the body and which involve the large vessels of the body. The large vessels of the body are in the brain and the heart and in the legs. So we get the frequent brain attacks or the stroke. We get frequent heart attacks or the coronary artery disease or the heart failure. And we get gangrene, we call it peripheral vascular disease, because of the blockage of the arteries. There is no circulation, we get gangrene and we have to cut the limb of the patient. These are the complications called microvascular. The microvascular, which involve the small vessels, they involve the eyes in the retina. So we call it retinopathy. In the retinopathy may manifest with the blurring of the vision, it may lead to the blindness, it may lead to the hemorrhage inside the vitreous hemorrhage. Then it also affects the kidney vessels, and when it starts affecting the kidney, it is called diabetic nephropathy. And the earliest way to detect diabetic nephropathy is do a simple urine test called the microalbumin. And a simple urine test having the microalbumin test, if it is high, take adequate measures to prevent the further progression. And also the nerves of the legs. We talked about the vessels, nerves. People start getting numbness, tingling sensation in the feet, and they start getting corns and calluses and trophic ulcers, and they don't feel hot and cold. If they are walking barefoot in the temples and everything, if they get any injury, they are not aware of that. It turns into an ulcer and it goes into a spreading infection all over the leg, and they have to undergo leg amputation. Walking bare feet in diabetes is totally avoided.
So talking about insulin, Is it necessary to take insulin, and what are the pros and cons?
Again, a good question for the viewers that first of all, remember insulin is the panacea of life. Patients who are type 1 diabetic patients where their body is not producing insulin, there is no other treatment except to take insulin and insulin. Whosoever may tell you that type 1 diabetes can be treated with the drugs, please ignore them. For type 1 diabetes, it is only the insulin, whether it has to be given twice daily, 3 times or 4 times. For type 2 diabetes, we start with the diet, exercise and some of the tablets. And remember, you have to take tablets regularly, and suppose doctor has given you some prescription tablet. Don't think this tablet is going to work for years together. Diabetes is a progressive disease. The treatment has to be modified from time to time. That is where the patient, they don't listen to us. They don't come for the follow-up. So we tell the patient, come at least every 3 months or even every 6 months. Tell the doctor to modify the drug to keep your sugar under check. So we have many other drugs. We give one drug, then we add another tablet, we add another third tablet. So some doctors give multiple drugs, 2, 3, 4 drugs to keep the blood sugar under check. Once 3 or 4 drugs are not able to control your blood sugar in type 2 diabetes, a time has come that because of progressive disease, pancreas has stopped producing insulin. That is the time you have to start insulin along with the drug. Where is the people, most of the people, they are afraid of starting and they don't start insulin. Whatever we tell them, Dr. Sahab, ab insulin start kar diya, insulin has to be taken lifelong. Listen, every diabetic over a period of time, maybe after 10 years or 15 years or 20 years, will require insulin for sugar control. Tablets work at certain stage till pancreas is able to produce certain amount of insulin.
How blood pressure and diabetes can lead to chronic kidney disease, and
Yes.
how to manage that?
See, we don't have to look into the numbers, the sugar number. Diabetes is a disease where all the culprits who are staying with diabetes, what you call the deadly cousins, blood pressure, cholesterol, they have to be managed. Why? Because hypertension, majority diabetes, when they are diagnosed, are associated with the high blood pressure. And this high blood pressure is the single most important cause of damaging your kidneys, what you call the chronic kidney disease. So, apart from looking at the number of sugar, you have to control your blood pressure also. And also I told you cholesterol, which is important for the heart disease. And nowadays we have certain drugs which not only control the diabetes, it control the blood pressure, it controls the cholesterol, it protects your heart, it protects your kidney.
Sir, my last question on this World Diabetes Day, what would be your message and why it is important to know your risk factors?
This time the World Diabetes Day, the theme of the World Diabetes Day, access to the medical care. It is a theme. Access to the medical care means the people at the remotest areas should have access to all kinds of the medical facility what a diabetes need. That is, our government is basically working very hard for giving an affordable, accessible, right treatment for all diabetic patients even in the remotest of the areas. That is the theme. And for that, everybody need to be very literate, need to be educated, need to be aware about the diabetes and its complication. Know your risk factor. If you have a family history of diabetes, if you are obese or overweight, if you don't exercise properly, you lead a sedentary lifestyle, if you are consuming a lot of junk foods and caloric dense foods, if you are smoking, if you take alcohol regularly, if your waist circumference is very high, beware. It is a high time to take care of all these things. I am sure if you take care of all these things, you will prevent the development of diabetes. This should be the message to all the viewers. Take care of your risk factors and don't be afraid or that telling I am having diabetes is the end of the life. It should not remain a social taboo in your life. Be happy, be comfortable, eat well, exercise well, sleep well, and you will lead a happy life even if you are having diabetes.
Thank you so much, sir, for giving us your time. It was a pleasure talking to you. Thank you. Thank you, sir.